Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have a very exciting session with Dr. Chaker. Dr. Chaker, thank you so much for joining. And on that
Thank you for
note, the
having me.
floor is yours to take away.
So I know how difficult it must be, the past year or so with COVID and not being able to shadow. So when I was asked to do this, I thought, you know what, this is perfect to as a way to give back, because I know it was stressful enough to find someone to shadow even without COVID. So I can only imagine now with COVID. And as someone who doesn't have a dentist in their family, I think it's really important for pre-dental students to really know what they're getting into and learn as much about dentistry to make sure that this really is, the right career for them. It would be really frustrating to find out, after having spent all the tuition money and all the, blood, sweat, and tears to do this career path, to realize that, this might not be the thing for you. So just to, a little bit about my of background about myself. I've been practicing for about 7 years. I did my, let me see if I can do, oh, there we go. Okay, so I did my undergrad at the University of Windsor in Ontario, Canada. And when I would say I really had no idea what I wanted to do. I actually did not want to go into healthcare because most of my family is in healthcare, but not dentistry. They're either in medical or pharmacy. And the healthcare route was just not for me. I didn't see myself as a doctor at all. And I wanted to pursue a master's in biochemistry. Ironically, when I started doing my thesis, I realized that I hated lab work, and I just hated all the statistics behind it and figuring out what percent, what concentration of the drug worked and why, and the lab reports and everything. It just wasn't for me. So that's when I started getting serious about professional school. And my mother suggested that I shadow a dentist, which I thought was disgusting, to be quite honest. I was like, my hands in people's mouths, like, why would anyone ever want to be a dentist? Plus, everyone hates the dentist. So I never liked going to the dentist as a child at all. Sorry if you hear my kids in the background, because it's dinner time and you know how it works. Anyways, so so I went and I started shadowing a general dentist, and I really didn't like his work at all. I just basically sat in a corner. There was zero communication. I couldn't ask any questions. I just, I didn't know what he was even doing. He didn't explain anything. It just wasn't a very good experience. And then I backed off and I was like, no, this isn't for me. And then I took my sister to a pediatric dentist because she needed to get some work done. And it was a totally different experience just sitting there. I wasn't even shadowing. I was just accompanying, with her for her appointment. And I absolutely fell in love with the pediatric dentist. And then I asked her right on the spot, I was like, can I come shadow you? She was very open to the idea. I shadowed her and she ended up writing me my letter of recommendation. And to this day, every once in a while, I'll try to, if I'm ever back in Windsor, I try to say hello. I'll call her office every once in a while. And I still recommend that patients go to her just because of how what kind of an impact she had on me. So anyways, to make a long story short, I decided to apply to dental school. I would say late in the game, because I feel like a lot of the students usually know what they want and by second year, third year, and I was already near the end of third year. So I actually took I did 5 years of undergrad because I kept changing my major and I didn't really know what I wanted to do. So I would say at the end of third year, beginning fourth year, that's when I got serious about applying to dental school. If it means anything to anyone, is that you're not late. You can't be late to the game. If you saw my classmates, a lot of it, I would say, while a lot of students are usually, your traditional track, there's also a lot of students who are not, this is their second career, they're in their 40s, they're already married with kids, and just, I don't really consider it late to the game. I just consider it, you really know what you want to do, by exploring different things. So I got into, when I applied to American universities. In Windsor, there's not really a dental school there. I applied to different schools in the US, and I got into NYU. And I was really excited. I moved there and I finished dental school there. And then I stayed there another year. I did my GPR at Lutheran Medical Center, which is now affiliated with NYU. It changed its name after I graduated. And then I worked for 2 years in New York. And then I moved to Michigan, where I don't know if you guys are familiar with the area, but Michigan, Detroit is right across the border from Windsor. And I grew up in Windsor, so I would actually commute. I was living in Detroit, but commuting to Windsor to work near my family, because my family was helping me. By that time, I started having kids, and my mom was helping me with my, watching my daughter while I was at work. So that's a little bit about me. I've been practicing for about 7 years now. And so why do you want to become a dentist? I'd say that that's probably, the most important question that you want to ask yourself, because it's a long path, it's a difficult path, and it's not something, while it's very rewarding, you want to make sure that you, that really it's the one for you, because there's a lot of different careers out there where you can do, where you can get the gratification that you get out of being a dentist while not really, doing dental work. I don't know if that made sense. I think if you probably one of the most important things is that you enjoy working with your hands. The aspect of working in people's mouths, or if you're disgusted by or grossed out by blood, all of that you can get over that, because if I can get over it, I think anyone can. It's not really something that you continuously think about after the first few patients that you see. It kind of gets easier. Do you like working with your hands? Do you like, seeing people anxious people and stressed people? Because most people sit in your chair and the first thing that they tell you is, I hate being here, or I really don't like you. I don't know why people think that that's a smart thing to say to someone, but unfortunately it is. And you should be able to communicate with them that you're going to get them out of pain, you're going to help them, explain to them the kind of, another thing too is that, as a dentist, working in people's mouths, people can't see what's happening in their own mouth, and they're literally sitting in your chair giving you, access to do whatever the heck you want. Well, first of all, they don't understand what you're doing. Second of all, it can be painful and traumatizing in a way, I guess. And you're working with a lot of sharp instruments, and they're just trusting you, so I get why it's very nerve-wracking. And that's why it's really important to be able to calm the patients down. So it's, in that regard, it can be very stressful, a very stressful job. Shadowing, I would say, is one of the most important things that you can do to really get a feel for the job. When you do shadow, don't be like me. Don't just, my first experience where I just sat in a corner and didn't do anything. I think you should definitely ask questions. Get closer, wear a mask, wear a face shield, and really get in there and see what they're doing. Try to see the different procedures that are happening. Talk to the patients, help around the office. I don't know, different states have different regulations, but if you can actually sit down and assist, especially with simple procedures, then I would jump at it. If you can assist with a filling or even a cleaning, or whatever you can get your hands on, or even front desk, help with front desk, learning the entire, this is another thing too. Actually, even until now, I'm still learning how the actual office, is managed and how it runs, because learning the dentistry is one thing, and then learning the business side is another. So if you can get exposure on, how patients are contacted, how the schedules are filled, the types of insurances that are out there, how people, how they pay how the dentist is paid. Not everything that comes into the office goes into in our pocket, especially as an associate. So people think, oh, the minute you graduate, you're going to be making millions. That's not the case at all. I still haven't paid back all my, tuition. So I think that aspect is also really important. So even if you don't really get to experience the clinical part, try to see if you can help with the front desk, with the paperwork. Try to just learn as much as you can, in a dental office. Another thing too is that don't just shadow one dentist. Try to shadow different dentists. And the things that a general dentist does and how their day is, it is very different from specialists, in the sense that, we do more variety of procedures. Our patients are usually, they come from all different walks of life, with different insurances, different concerns. The specialists, I think, because they usually do not take insurances as much as the general dentist, and they are more limited in what they do, it's a totally different and unique experience. And I think that the more exposure that you have to different specialties, the better you'll be able to understand how the specialties work together, and know if you want to specialize too. Because once you get into dental school, you also want to be able to focus, or guide yourself towards that specialty if that's your interest. I, for example, like I literally, I didn't even, this is kind of embarrassing, it's going to sound embarrassing, but I don't even think I knew that we had 32 teeth when when I got into dental school. Like I literally knew nothing about, aside from, oh, you get a cavity, you get a filling, oh, a root canal treatment. I remember there was the smell of rubber when I shadowed a dentist doing that. Like she used fire. Like that's all I remember. Like I really didn't have much background in dentistry, which I wish I did. I really wish I did shadow a lot more, and learn about the different specialties. I just knew, I thought, oh, there's a pediatric dentist, there's an orthodontist, and a general dentist. Oh yeah, okay, maybe there's oral surgery as well. I didn't know that about perio. I didn't know about prost. I didn't know about oral path or oral radiology, or TMJ specialists, or it just, I didn't know about any of that stuff. And I think if you expose yourself to all of that and you read about it before, it will only help you stand out better in your application, first of all, because you can discuss all of that in your interview and in your personal statement, and it will help you decide what you want to do as well. Grades and extracurricular activities, I would say, so when it comes to grades, as someone who didn't decide, to do it from early on, my grades were not always the best. And I just want to, I put that point in there to kind of motivate someone who might think, oh, my grades won't cut it. I don't think that you should ever think that way. I think if you really want it, you can take an extra year, do a master's, do whatever you got to do, pull up your GPA, because it can be done. Grades aren't everything, and add things to, to make your resume better, like the extracurricular activities. And it just doesn't have to be just at a dental office. Like, okay, let's say you assisted, or, at different dental offices. You can also, like, I volunteered in the ER, in the hospital. And that also shows that, you're able to communicate with patients, you're able to work in a medical setting. So try to do different, even if it's not towards the same career, you can still, give back in other ways. Soup kitchens, for example. I don't know if all that stuff is still happening with COVID, but hopefully now that things are starting to open up, you guys can, do more of that stuff. But soup kitchens, trying to remember what else I did. Just around campus, whatever volunteering opportunity that there was, I used to try to do it, to just basically make my resume stand out better. And I think I was able, my GPA ended up, I think, it went up from like a 3.6 to a 8 or 3, something like that, just by taking an extra year and taking a lot more, courses to bring it up. So I don't think that you should, be deterred away from it just because of grades. The other thing is networking. There is nothing better than getting to know dentists in your local town, telling them that you, especially if you have a dental school. So if you have a dental school where you live, or the dental school that you're interested in going to, try to, obviously a lot of the people who teach at dental schools are dentists themselves, right? And they have part-time, clinical hours where they go to their offices, and so if you can, network with them, shadow them, ask them about the dental school, see what kind of connections you can make. I think that's another way to enrich your, pre-dental experience that not everyone does. So if you can, do that, it's a huge benefit. Try to see, the people who work at the dental school and get to know them. I know that that's, probably not something that comes easily, because you'd have to really be living close to it. But one thing that I thought I'd mention. And then, last but not least is embrace the journey. It's a long path, and you're going to be going up and down and up and down. And some days you'll be so motivated, some days you won't be. But it's definitely worth it in the end. It's not something that, while some days can be very stressful and I'm like, why am I doing this? Like, why am I even a dentist? Other days I'm like, nope, this is exactly what I love to do, and I can't imagine myself doing anything else, and I'm so blessed to be here and doing this. And you're going to be, I think being in healthcare, we're constantly having to learn and expand our knowledge and go for continuing education. So it's basically, you're going to commit to a lifelong, of learning. So don't think, kind of make it your lifestyle, that this is who I am, this is who I plan to be. And so be committed to it, because it's definitely worth it, and enjoy it. That's, I guess, try to enjoy it, try to enjoy the ups and downs of it. So what is a general dentist, and how are we different from specialists? Have I considered specializing, and the pros and cons of specializing? What I like, basically, general dentist, when you graduate dental school, you know the basics. You know how to do your basic fillings, extractions, root canal treatments. Some people might get an exposure to some gum surgery, some cosmetics dentistry. And then you get out there, and now you have a license to actually start learning. In dental school, we see 2 to 3 patients a day. When you graduate, you're going to be seeing upwards of 15, maybe 15 to 30 patients a day. So the learning curve goes way up, and it's very steep. And within the first couple of years, you're going to realize that while dental school teaches you the basics, but most of the learning, comes on the job, because there's only so much that they can cram in 2 years. Well, 2 years, 4 years total, but really 2 years of working on patients. You're going to be taking continuing education courses. You're going to fall in love with certain things in dentistry and start to hate others. Like when I first got out, after I did my GPR, a general practice residency, I decided to do that because I wanted more. I wasn't really sure what I wanted to do after dental school. I knew that I wanted more exposure and more training. And it was a really, it was kind of, the best thing that I could have done for my career is to add another year of learning, because first of all, you get paid to learn instead of paying to learn. Now, when I have to take continuing education courses, each course is like minimum, you're looking at $2 to $5 grand at least. Plus you're taking away time from, family and working. You have to travel for it. So to be in a year-long environment where you're learning under different a lot of the residencies you're working with specialists, like when we were doing the oral surgery, we were doing it with oral surgeons. When we were doing the root canal treatments, we were doing them with the endodontists. When we were doing the treatments, like the implants or the crowns and bridges, we were doing those with the specialists as well. So, and you're getting paid to do that. So there's really, it's like a no-brainer. If you can do a residency, definitely do one. So have I considered specializing? For when I first after residency, after the first year, I was doing a lot of root canal treatments in the first office that I joined, and I thought, you know what, maybe I like, I wouldn't mind being an endodontist. So an endodontist is someone who does root canal treatments, retreats teeth. A lot of them are now doing even implants and some surgery as well. And then but I still wasn't sure. I was like, no, you know what, I'll do another, I'll work for another year to really see if it's really for me. Because I couldn't imagine myself leaving prost work. I absolutely, and now that I've been doing this for a while, I absolutely love prost, which is basically like crowns, bridges, veneers, and I love doing befores and afters, where you transform someone's smile. I would say that that's now my favorite part of dentistry. So I'm kind of happy that I'm, just, doing general dentistry. What I like about being a general dentist is that if something is too difficult for me, I always have, I can refer it. I'm not under the stress to do it. So with root canal treatments, for example, the front teeth and, the side ones are much easier. Well, I shouldn't say much easier, but they tend to be easier in general than the back molars. So I try to, if it's something that's too stressful or too difficult, I can say, you know what, why don't you go see your the specialist down the road? They will take excellent care of you. They'll do it much faster, and it'll be done, top notch. So, so they get, all the difficult cases. Same thing with oral surgery. If something is easy and I can remove it, without potentially, a lot of complications, I'll pull a tooth out. I don't mind doing minor surgery. But if it's really close to the nerve or really close to the sinus, or they might need a bone graft, or they're on blood thinners and I might not be able to control their bleeding, wonderful. I can always refer it to the oral surgeon, and that's, I think, what I like about, and it's wonderful to work with specialists. I think that's another thing that I really like to do. I love to collaborate with specialists and refer a patient, get the patient back, and, they do their part and then I do my part. It's really nice once you get to that level where you're working with different specialists and you're collaborating on cases. So the two special, well, actually I should probably step back a bit. When I first applied to dental school in the first year of dental school, I really thought that I wanted to do pediatric dentistry, because that was the lady that I fell in love with. Like, she was a pediatric dentist, and I thought, oh, that's what I want to do. I just want to do kids. And then when I started working on kids, I was like, no way do I see myself, for the rest of my life acting like a clown. Like, hi there, like, it's okay every once in a while. I don't mind seeing, a kid or two during the day, but to always have that like high pitch and, oh, here comes the little, straw, and we're gonna give your tooth a little shower, and I can't do that all day long. I cannot do it. And especially, kids that are younger than 4, 3-year-olds, 4-year-olds, I'll do it. I just this Tuesday, I think I had a 4-year-old in the chair, or 4.5-year-old. So I don't mind doing it every once in a while, but it is definitely not my thing. So, and I admire the ones who can do it all day long, that, and they're fast at it and they're quick and they get them in and out. Amazing. They're truly amazing, the ones who can, do pediatric dentistry. So that's the first specialty that I was like, oh no, I can't do that, once I actually started working. And then endo, the root canal treatment, I decided against it because I can't imagine myself, not doing the restorative part of dentistry. And the past 2 years, I kind of considered prosthodontics, but right now I'm at a stage of my life where my kids are too young. I don't see myself as being able to dedicate the the time into going back to dental school to specialize. Sometimes I think maybe I should have done it straight out of dental school. But at that point in time, I really didn't know what I wanted. So that's why I think as a, if, one advice to you guys is when you're in dental school, truly, think about all the different specialties and see if you want to specialize, because it's after you stepped out, it's not impossible, but it's definitely harder to get back in the game once you have a family and you might not, like the closest dental school to me is over an hour away, and it becomes very difficult once you plant your roots to, move your family around. So if you want to specialize, learn about all the different specialties earlier on during your dental school and even before dental school, so that you can keep that in the back of your mind and not, have to decide later on. I don't know if you have any questions, by the way, feel free to, interrupt and ask, or any comments or anything that, you might want to add. So what does a typical day in my life look like? I am very lucky in that well, I shouldn't say this. The first few years of work, until I was able to have more experience, my day, I think, used to start at 8, and I had your typical 8 till 5, I cannot do it now with kids and, basically kids having to do pickups and drop-offs and all of that. I can't do the 8 to 5 anymore. And I'm very lucky to have found offices that have allowed me to work shorter days. So typically my days are 9 till 4, or 9 till 3 or 3:30 even, in some offices, which I love. I love being, if I can finish every day by 3 p.m., that's ideal for me, because one thing about dentistry is that it is it's very tiring on your body and your back. If you're not, if you're, after the first few years of working 8 till 5 every day full time, I was exhausted. I was burnt out. I started to really hate hate everything about it, because I had no time for myself and I wasn't taking care of my body. So you quickly learn that you have to keep up with your, with your health. You have to keep up with just maintaining your, your physical abilities to do things. You have to get massages, do whatever you need to do to be able to maintain your body posture. There we go. That's a good reminder for me to sit properly, because working in such a tight area and constantly looking down, it can be really, it can take its toll. So typically, I arrive at 9 a.m. We do a quick morning review and a huddle for how the schedule looks like, what patients are coming in today, what procedures am I going to be doing, if someone canceled, if there's an emergency that might be coming in. So we discuss all of that. Typically it takes, I don't know, like 5-10 minutes, and then and then from there on, I see patients. You start out, you go, you numb your first patient. While they're numbing, you might have to go do an exam for the hygienist who's cleaning someone's teeth, or doing a scaling and root planing, and they might need to be numbed, so you go numb them as well. Then you go, so you're constantly going back and forth between patients. You finish patients and then you sit down. I sit down and I do my charts. And then I look over, okay, do I have any cases that need to be sent to the lab? Are there any lab slips to write? Did I take any photos, any befores and afters that that need to be edited or saved or anything like that? And then are there any patients that I have to follow up on from the day before or the week before? I try to finish everything by 4, the latest, so that I can be home by 5. Because, and then after that, the second shift at home begins. But that's basically typically how the day goes. What kind of complaints do patients present with? I would say the biggest one is pain. it's unfortunate that a lot of people don't come to the dentist unless they're in pain, because that it's kind of like a cycle, and then you associate the dentist with pain. But if you're someone who keeps up um, with their oral hygiene, and you're following up every 6 months, then really you don't get to a point where you reach pain, because we can detect the cavities when they're too small to be painful. So that's what I usually try to communicate with patients, is that if you're keeping up every 6 months, coming in for your checkups and for your cleaning, then you're going to have a much more pleasant experience at the dental office. But now you guys are pre-dental students, so you want to learn more about when them coming in. So basically, a lot of them come in because of pain. They want their pain to be taken care of. Most of the time, we can take care of the pain right on the spot, but a lot of times we just have to put them on some medications, maybe some painkillers, some antibiotics, until we have the time, because sometimes they need a root canal treatment, which might take at least an hour, and you don't have that time in your schedule. So sometimes you do have to give them some medication and bring them back on another day. Another really big thing that patients come in for is cosmetics and whitening. People really care about their smiles and how they look, so that's another heavy area. The one thing is, regardless of what the patient is presenting with, and what they want, why they came in and are in your chair, it's really important for you as a dentist to look at the overall oral health, and see, okay, I know their concern is this one tooth, but how does everything else look? Is there a broken tooth in the back that they don't care about because no one can see it, but is actually infected and could potentially spread to other parts of the body, or cause more destruction in the bone? Or is there are they smokers? Is there a white patch on their tongue that might be the start of cancer? Are they grinding their teeth to the point where they're starting to lose all the enamel on their teeth? Are they someone who has something like if they're bulimic, or if there's someone who throws up a lot, do they have they eroded their teeth? So you have to within the first time that you meet the patient, kind of determine, are there other things going on that I have to address? Because even though they might just have that one issue that they want solved, you're kind of responsible for their entire oral health. And so it's important to communicate that with them, while still, okay, fine, this is your concern and I get it, this is what we're going to do about that, but have you thought about everything else? Can we take a look at all your other teeth and see what needs to be done? We don't have to do it that same day, but at least let them know that they when they come back, that you're going to be doing a full exam, you're going to be looking at different areas that might need treatment, so that you're not just you're not ignoring the big picture, because one of the most frustrating things is that when, or for me at least, is when I see patients where they have patch up work, like they over the years, every time they go from one dentist to another, and they're constantly jumping, and every time they have work done in different ways, and then none of it matches. So that's one thing that that I thought I would mention here. What procedures do I do? So exams and consults, that's basically, how every patient that walks in, the first thing you got to do is an exam. What do they need? Are they in pain? Are they not? What do you see on the x-rays? Restorative treatment is basically fillings, crowns, bridges. Fillings are, when the cavity is small enough that we can just drill it out and fill it. I was actually there was a young girl who was shadowing me a couple of weeks ago, and she asked me, so when you drill the tooth out, like that's it, like that part of the tooth is gone, it's not coming back? I'm like, yeah, it really is, like we're replacing it with something else. And it's all fillings, crowns, and bridges. At the end of the day, they're all plastics, they're ceramics, they're metals. So we're replacing a natural tooth structure with something man-made. And you got to if something that God has given you has failed you due to lack of care, then how do you think man-made things in your mouth, they're not going to be forever, and they can also fail if you don't take care of them. So that's one thing that also patients don't really understand, is that you really have to take care of dental work, because dental work can fail at the end of the day. It's not forever, and they think, oh, I just paid $2,000 for this root canal treatment and crown, and you're 2 years later, now I have a cavity under my crown. Well, yeah, you didn't keep it clean. Like, if your own tooth got a cavity, how can you expect the crown to last forever? But anyways, so that's restorative treatment. Dentures and partial dentures, some general dentists don't really like to do dentures, but I personally love it. I think that it's one of the really most rewarding ways, because if someone who has no teeth, they can't eat properly, they can't talk properly, they're even the way that they look. I'm going to show you guys a picture later on. I think I included one of dentures. Their entire, everything about them changes just because they have no teeth. So to give someone dentures, and functional dentures that are actually, they make them look better, they can actually use them to eat, it's just one of the most rewarding things to me personally, because you've really changed their lives. So dentures and partial dentures is, one of the ways that I really, one of the things that I enjoy about, one of the things that I enjoy doing. Oral surgery and extractions, like I said earlier, I don't mind doing them if they're, not too complicated. After the first couple of extractions in dental school, I got over my fear of blood. Unless it's when I see blood on my kids, I'm terrified. That's a totally different story. But in the mouth, it's like, it's okay. It's blood in there's blood in my body is like it's totally okay with seeing blood in the mouth. But anywhere else on the body, I'm still grossed out and scared of it. So that's very weird. Endodontics and root canal treatments, that's basically when we remove the nerve out of the tooth. I mentioned that earlier too. So I don't mind doing the easier ones, easier cases. If a case is too challenging to me, I tend to refer it, because the less stress, the better for me. Diagnostic tests and technology. I would say, over the past few years, even since I graduated dental school, there has been, dentistry is constantly evolving, and there's always new things to learn on the market. So when I was in dental school, for example, we had just barely started to train with the intraoral scanners, and now almost every office I work at has an intraoral scanner. It's almost becoming the standard. But that wasn't, when I graduated in 2013, so it hasn't even been that long. Another thing too, for example, like when I was in dental school, we learned how to do silver fillings, but now I think in at NYU, when I think a few years after I graduated, they stopped doing silver fillings, like, because I don't even, the dental offices where I work at, they don't even have silver fillings anymore. Like, it's just, there's still a place for, there's always a place for, to use them, but dentistry is constantly evolving, and so technology is constantly, changing and making it better and easier for us. So, I'd say radiographs and x-rays, cone beam CTs, scans, those are really helpful. So that, because x-rays at the end of the day are 2D images. And then CT scans, they give us a 3D representation of the teeth. So, with placing implants, with root canal treatments, and surgeries, they are very helpful, because you can get, you can see exactly where the nerves are, how far away, when you're placing implants. So 3D is always, the more information that you have, the better. Oral scanners, like I said, it's like a little camera, it goes inside your mouth. And using the oral scanners, you can then go ahead, your instead of taking, analog impressions and all that goo in your mouth. I don't know if you guys had, ever had to take impressions, but oral scanners kind of eliminate that goo in the mouth. And then, once you scan, you can 3D print, and you get, the all the teeth and a model of the patient, you know, on your screen and in your hands within a matter of minutes. Lasers is another thing that we use also for gum surgery, and for some offices even use them to remove cavities and to, you know, drill teeth with them. I've never, I've used the laser twice, one for minor gum surgery and once for to help with the healing of a canker sore. So there's different also things that we use lasers for. And now we're coming to the cases. So this is an example of a case that came in. This was an 8-year-old girl, and she, you know, typical trauma, an emergency that comes in. She fell, I think, on a scooter at school, and she came in, she was crying. You know, her front teeth are basically, you know, they're broken. She was really sweet though. And you know, when you can only imagine how thankful and how happy she was, her and her mother, you know, for getting, you know, her teeth back within an hour. You know, she walked in crying and super scared and nervous, and she walked out happy. And I think that these kinds of appointments are what give you your little happy moment that, yeah, you know what, this was worth it. And I'm so thankful to be able to do this, because these are the things that, you know, at least for me, make me think I'm able to change someone's life, and I'm able to help. And it's truly a rewarding feeling. So I did the, I don't know if you got, you know, if you know the difference between fillings and crowns, but I did these with fillings, and and if you're into art, you can even, you know, stain the teeth differently, so you can see like on the incisal edges, or like the biting surface of the tooth near the bottom, I was able to add like little white marks, you know, and kind of recreate the shape of the teeth to match her other teeth, rather than just making them like, you know, two big yellow composite fillings, which might not look as natural. So she was really happy. The mom was very thankful. This is another case, an example of what fillings are. So you can see in the top left, this is how the initial was. There's cavities, you know, on the biting surface. There's cavities on the buccal. You don't really, most of the time, you don't see the cavities that are in between the teeth until they are very big. You can kind of see the shadow here, but for the most part, in between the teeth, we rely on X-rays to see. This is, do you guys see my pointer, by the way, when I'm moving it around? Or I don't know if you.
Yeah, I can see it.
Okay, good. So this is how after the teeth are drilled and cleaned up from all the cavities. So basically there was cavities between the teeth. So these were all cleaned out. And this is the top view. And you can imagine, like, you know, now that these teeth are drilled, like that's it, your tooth structure is gone. So now you have to fill it. This is how, you know, after filling them. So, you know, we pick a shade that matches, we you know, contour the teeth properly so that they would, you know, fit better together. And you know, and you just make sure that they're functional, that they're tight together so that food doesn't get stuck between the teeth again. And that's basically, this is your typical, you know, a drilling and filling case, basically. This is actually the denture patient that I told you. So you can see how, you know, the before and the after of someone with and without teeth. You know, she looks so much older. You know, she can't really eat. It's just, you know, night and day difference for her. So this is one of the main reasons why I really like dentures, because they do leave a huge impact when they're done properly. This is another example of a restorative case. I did a crown. Wait, let me just move that. Okay, maybe over here. So I did one crown on this tooth, which is this tooth over here, the discolored one. This patient had trauma as a kid. I think when I treated him, he was either 18 or think it was 18, 20 years old. I can't remember anymore. But when he was younger, he basically had trauma to this tooth, and that's why it's discolored. You can see it's much more gray than the other teeth. If you ever have trauma to your teeth, and they die over time, one of the things that can happen is they can discolor because blood that might be trapped in them basically discolors over time and starts to darken the tooth. So you can see how there's a filling here, a white filling, a patched up one, doesn't really look that pretty, and then one over here as well. So what we did was we covered that. I drilled this tooth, made it into I prepared this tooth actually for a crown, and then I replaced the filling over here, replaced the filling over here, and we just by, changing 3 teeth, and he also had some whitening. He also whitened his teeth. He got a new smile. And this was one of my favorite cases when I was first starting out. This is another example of, kind of in the middle. If you guys are interested in seeing how a crown prep looks like and what is around it, I'll explain in a bit. But basically, this tooth over here is a crown, prepared for a crown, and this tooth becomes this after the crown is placed. This over here had a filling, and if I was to outline it, it goes all around like so. This is all the filling part. This tooth also needed a crown, and this tooth had a filling. So this is how the after looks: crown, crown, and filling. So that's, and the cord, the black around it is basically cord that we place to push the gums out of the way, so that when we take an impression of the tooth, we're able to capture the entire tooth, so that when we send it to the lab can create a crown that fits all, grabs the tooth from all 360 degrees. So we kind of need the gums pushed out of the way, and that's why we pack this cord around the tooth. Usually we leave it in there for a couple of minutes, and that's why I took the chance to take a picture of this. These are 2 different cases here. These are actually my favorite types of cases. A before and an after. You can see how, basically neglect over the years, cavities, chipped teeth, broken fillings over time. We got her in, we cleaned out all the cavities, replaced them all. I did all of that using fillings. She was, very patient. Ideally, she technically, could benefit from crowns in this case, because these fillings are very, very large. But she couldn't really financially, because she couldn't afford crowns on all her teeth. So she couldn't afford to straighten her teeth and get braces. So we opted to just do fillings for her. This case over here, we ended up doing, you can see how, her front teeth are not really the prettiest in terms of shape. So we kind of fixed these, made them look a bit nicer, more aligned. We also did a crown on this tooth. And she said she might come back to actually make this last tooth, but financially she wasn't ready at that time to make this last tooth match with this one, which I think would, make her smile even nicer. But for the most part, I think, we went a long way with just one crown and just some bonding on these 2 front teeth and reshaping them basically. I hope that those kind of gave you an idea of what you can do as a general dentist. Sorry, give me 1 second. All right, so I hope that kind of, gives you guys an idea about, the different types of cases that you can do. When it comes to, those were some questions that someone asked me on Instagram, so I thought I'd quickly answer those. Study and workload in comparison to undergrad. I would say it's definitely heavier in dental school, but because you're more focused, it's not as bad because you're kind of more focused. You're not at least for me, that's how I felt. And I enjoyed it. While dental school was brutal. I would say, I don't think anyone, says that it was a walk in the park, but there's definitely things that I enjoyed about it. And you're working towards a goal, which I think, in undergrad, sometimes one of the things that kind of made me feel down is that the future is unknown, and you don't know why you're even doing this, and is it going to work out or not. But in dental school, you're working towards a degree. You already know you have something that you're looking forward to. So that to me kind of helped me with studying, and that part wasn't as bad. But I would say it's heavier than undergrad. Lab reports and assessments are definitely there. They're just in a different format, because now you're working, instead of, you might still have to write up some stuff, but for the most part, you're working with your hands. You're making cases. So it's very heavy, a lot of handwork. When is the best time to pursue a specialty / residency? I would say from year 1 in dental school, start to explore. Don't wait until it's too late. So from year 1, I think you should start to look into different specialties if that's something that you want to pursue. Importance of resolving patient anxiety and stress. I think it's really important to be able to make the patient at ease. Take the time to get to know them, take the time to talk to them, connect with them on a human level before going in there and treating them, because that's ultimately one of the best things that you can do to calm them down, make them realize that you're there to help them, and you're going to do your best to to treat them, and you're not just out there hungry for their money or something, and you're not going to you're going to do your best, and you're going to treat them like a family member. So and also, the less stressed the patient is, the easier it will be on you, because they will be more relaxed in the chair, they will open more, they won't be as fidgety. So it all goes back to you at the end. Advice to future dentists. Nothing worthwhile comes easy. It's a hard path, but it's definitely worth it. And I really don't regret doing it. Believe that you can, and you're halfway there. I would say that you're even 90% there. You really just have to believe, and keep pursuing your goals. Don't give up on them. Another thing too is that, sometimes we look at people who are, might be 3-4 chapters ahead of us, and we might think, oh, they're successful because they are so much better than me. They don't procrastinate. They have their life figured out. They don't have self-doubt and imperfect routines. We all have the same insecurities. We all have self-doubt. We all have all of these habits that can deter us. So it's just that you have to know that this is perfectly normal, and we all go through these roller coaster emotions, and you just have to, when you're on a high, you have to ride it, and when you're on a low, you got to find whatever is going to get you back on that high, whether it's support system, family and friends, faith, sports, and working out, enjoying yourself a bit, have an hour or two for pleasure. We all go through the same thing. Step out of your comfort zone and trust yourself. I think that's probably, for me personally, one of the most important things that I struggle with, getting out of my comfort zone. But I promise you that the more that you do it, the more opportunities you're going to get, and the more successful that you'll be, because you will meet people, and opportunities will come at you. You just have to get out there and trust yourself that you can do it. And don't let fear stop you, because the things that we're usually most proud of start with fear, and they end with happiness. So get out there and tuck fear in the back of your mind, and step over it, and just keep going for it. I want to thank you, guys, for giving me this opportunity, and I hope I was able to somehow shed light about my journey, and what it's like to be a general dentist. And yeah, I guess best of luck with your application, and your path to becoming a successful dentist, hopefully one day.
Thank you so much, Dr. Shaker. So we have a couple questions on our YouTube chat, if that's okay with you.
Yeah, for sure.
Awesome.
you, Dr. Chaker. So,
How are you?
from our YouTube chat, we have a question. What was your favorite thing about attending NYU Dental School, and what made it special from other programs?
So I personally really like living in New York City. I don't think that that's something that, I will ever forget. I truly appreciated the years that I spent there. When it comes to NYU specifically, I really enjoyed the large class size because we had people from literally all walks of life. And that is something that I don't take for granted. As a minority myself, I really appreciated that. They are very open. New York City is just filled with every single culture and race, and it's just that culture, the culture. I don't know if you can say the culture of New York City, but I think that was really. If you guys can give me just 1 second, okay? Sorry guys, my husband had to step out, so I'm talking. Anyways, so living in New York City was definitely something that I loved and that I appreciated a lot. Okay mama, it's okay. طيب. إيه، أعطيني حق بوسة. Okay, طيب. Yeah. So like I said, the other thing that I really like about NYU specifically is that they have all the specialty programs. So the exposure that you get, if you wanted to specialize, and even if you didn't want to specialize, just having all the specialists there, and you can go and you can check out all their different programs. I think that that's a huge plus because not all dental schools have the different specialty programs. So that's one thing that I really liked. Trying to think what else. I just really loved NYU. I couldn't have picked a better school. But I think everyone says that about their school regardless, so I'm biased.
That was perfect. Thank you. And
Yeah.
we have another question. Do you plan on opening your own clinic in the future?
I do really hope so one day. I don't know when that will be. Actually, I should say that I go back and forth. Some days I really want to, and some days, with my kids, as you can see, they, no, mama, you can't go with Baba. So, my kids are just, they take so much out of me, as you can see, that some days I'm like, I don't know if I want that added stress. And I like working as an associate dentist. I like being able to not have to worry about the business aspect. So that's something that, but it's not for everyone. Some people can't wait to work, to be their own boss. And there's definitely a disadvantage of being an associate and working for someone else there, because you can't really pick and choose everything that want to do in the office. At the end of the day, you don't own the place, but at the same time, you're not doing the hiring and the firing, and you're not جيبي لي مطاطة وفرشاية مشان أعمل okay, sit down so I can do it for you. You're not doing the hiring and the firing, and it's and all of that. If you're naturally someone who's good at business, then you'll love it. But business doesn't come naturally to me. So maybe when my kids are older, one day I hope that I can do it, but not right now. Right now, I think working 4 days a week with my kids, it's more than enough for me, to be quite honest.
Thank you. And we have time for one last question. As a Muslim woman, have you experienced any social adversities?
Oh man, that's a huge loaded question. So I grew up in Canada, and I would say that because I was there since a very young age, I've learned how to. I would be lying if I said it doesn't get to me, but I think every person from any race. You know, we live in such difficult times, and people are just, regardless whether you're Muslim or Asian or African American, Black, you know, whatnot. I think that all, yes, yes. I think that all races are just, you know, struggling these days. Um, I, I think you know, my hijab, I just didn't let it stop me or get in my way. You know, I was able to, you know, if I ever needed to do something differently during dental school or residency because of my faith, I just explained myself. And, you know, I need to step out to pray, or I'm fasting. Can I, you know, go out of this so that I can break my fast and come back in? And you'd be surprised, but when you explain to people this stuff, they're very open, and they're okay. I'm gonna give it to you. They're very open, and they actually are, you know, they're very understanding. They're open, and they'll help you. شو بدك لكان أي وحدة هاي.
Awesome. Thank you, Dr.
My
Shah.
kids, my kids are just, I told my husband I need an hour, and he's like, your hour is up.
All right, I'll let you go now. Thank you so much.
No problem. Sorry about that, you guys. I'd
Don't
love
worry, Dr. Shaker, thank you so much.
Ever, but
That was an extremely informative session. I want to thank you for joining the session. And I also want to thank all our viewers for joining and tuning in. For those who are tuning in, the quiz can be found on our Linktree or our GroupMe. And if anyone has any other questions, please make sure to check out Dr. Shaker's Instagram. It can be found.
yeah, you guys can message me whatever you want. You know, I'll try to answer without kids screaming in the background.
Awesome. Thank you so much, Dr. Shaker. And I want to wish everyone a great rest of the day.